At it now, please. Thanks, Jill. And I'll let you know, Chair, as soon as she sends me a message through.
Thank you.
The streaming is now live, Chair.
Great, thank you. Well, good morning, everyone. I'd like to thank all of you for being here this morning. I hope you've had a great holiday and that you're raring to go, because we've got a lot of business on the agenda today and some important discussions to be had in relation to what's been going on here in Darlington and how it's been affecting children and young people. So if we could begin with attendance at the meeting, can I hand to you, Alison?
Yes, certainly, Chair. I'm just going to run through their members, if they can just say if they're confirmed that they're here, please. Councillor Ali, I don't seem to have a note that she's present in the meetings. Unless anybody has apologies, I'll mark her as absent. Councillor Barch, likewise. Councillor Cruddas?
Here.
Thank you. Councillor Mrs. Cully?
Oh. Yeah, I'm here. I'm here.
I can hear
just oh dear.
No worries. Councillor Hughes.
Signal.
Sorry, Councillor
I'm here.
Hughes.
Thank you.
Thank you.
Yep.
Councillor Lister.
Yes, I'm here.
Thank you, Councillor. I've got apologies from Councillor Lucas. Councillor Renton.
Yeah.
Thank you very much. Councillor Snedker.
Yes, I'm here, Alison.
Thank you. I should also have said I had apologies from Councillor Bell as well. I've also got apologies from co-opted panel members Nick Lindsay, Tim Fisher and John Armitage. And the various officers will be introduced as the items come up, Chair. Thank you.
Thanks very much. Next, any declarations of interest in relation to our agenda today? No? Okay. Then thirdly, to approve the minutes of our meeting of the Scrutiny Committee held on the 2nd of November. If you can have a quick look at those, we'll go through page by page, and don't be shy, just either raise your electronic hand or give a wave. Okay. Page 1. Page 2. Page 3. I'd like to suggest one amendment in relation to page 3, and that is the final paragraph in section CYP 12, and it is the chair requested that future annual reports contain governance information so that scrutiny members can be assured that the director of adults and children's services of the authority is attending or being represented, and that lead members are attending their 6 monthly meetings as set out in governance arrangements. And that was one of the things that we discussed at the meeting. And I'm sorry I didn't pick up on that, Alison, when I saw the minutes originally. I can give you that text.
Yeah, that's not a problem. I can amend that. Thank you.
Thank you. Page 4. Page 5. And page 6. Then can we accept these as a true record? Great. Thanks very much. Wonderful. If we could turn now to item 4, which is the medium-term financial plan. You've noticed from the agenda that you were asked to have those papers handy. Hopefully you've got them all to hand. And I'd like to welcome Elizabeth Davison to our meeting. Elizabeth, can I hand over to you?
Absolutely, Chair. Thank you very much. Hopefully all members came to my presentation pre-Christmas, where I went through all of the MTFP, and what I said I would do was come to each specific scrutiny committee in case there was any questions relating to your particular areas that I could answer for you. So really it's back over to questions. Is there anything specific I can help you with regard to children and young people?
Great, thank you very much. Are there any specific questions that anybody would like to ask? And if there is, if you could please highlight the page that it's on, if it refers to a specific, or if it's a general question, I'm willing to take those as well, and I'm sure Elizabeth is too.
Sure.
So I'll open it to the floor. No. Well, Elizabeth, oh, sorry. Yep, Councillor Renton.
Sorry, last minute jump in there. It's not necessarily a question, and it's not necessarily for Elizabeth, but it is to do with the MTFP. I'm just concerned that we've become too comfortable in the assumption that every year the cost of children's services has to increase because the amount of children are always going to go up in care, and this is always going to be the trajectory. I've been looking at a lot of other councils and how they've reformed their children's services departments, and I think there's a lot of learning we can do, certainly when budgets are stretched, in terms of trying to tackle problems as early as possible and identifying problems before they become problems to avoid children having to come into care. And I think for too long we've been business as usual in Darlington, and we now feel that this path that we will always increase the cost is just the norm, and it shouldn't be, because it can't. I mean, where will it end? So I think, you know, we all know how difficult this MTFP has been, but it's only going to get worse every year. So, you know, I think there needs to be some best practice sharing. There's a lot of stuff on the LGA website, specifically about Essex Council, who I saw a presentation on last year. They've done a lot of work reducing their child services budget while working really closely with families and reducing the amount of casework that care workers have in order to make it a more efficient service. So, you know, maybe now, you know, Susan Joyner did a great job, but we have an opportunity here to make some big changes. Maybe now's the time to look at ourselves in the mirror and make those changes.
Right. Thank you very much for that, Councillor Renton. I'm not going to ask Elizabeth to answer that. If we have Jane here or someone who can speak to some of the things that have been going on in children's services. Chris, I see that you're indicating. Would you like to come in?
Thank you, Chair. Yes, I'm just I'm the head of one of the heads of service that sits under Jane. Jane's just on leave today, so has given her apologies. I think really valid point in terms of the need to kind of turn the curve, as it were. I think one point I would make in response is that much of that work has started with the partnership work that we're doing with Leeds through the DFE funded Stronger Families programme. So it very much fits in with a number of the points that Councillor Renton made around the need for early intervention. So we've done a great deal of work over the last 12 to 18 months to really embed earlier intervention practice. So we've started what's called a family group conference service, or really expanded our family group conference service, which is designed to really identify very, very early on in our involvement with families and really support the families to facilitate their own family meeting, which allows them to be very open as a family group about what the issues that they're facing and to come up with their own solutions. And very much that the national and the international research is that family developed kind of plans that are done in cooperation with children's services rather than children's services creating plans for families have a much more longitudinal impact. So we're very keen to embed that family group conference at a very early stage. This is before we're kind of having those discussions around children needing to come into the looked after system. So we are seeing a decrease in the number of children coming into our looked after systems, and we've seen that throughout this year. Unfortunately, you know, we are in a position where we have the current numbers of children that are looked after, and whilst there's work also going on around what's the best outcomes and routes for those children, the two have to be kind of done in partnership, really. So we have much more of an ability to impact, I think, for those children prior to them becoming looked after, clearly, but there is that challenge of once they become looked after, us needing to plan very sensitively and carefully for their journeys. But I think really just to give Councillor Renton and other members really some reassurance, we were aware of those high looked after children's numbers, and that wasn't a sustainable model, and that's been really a key focus of the partnership work that we're doing with Leeds and supported by the DFE with that.
Thank you very much, Chris. Can I bring Councillor Snedker in, please?
Thank you, Chair. Yeah, interesting to hear what the reply to that question. I see that the first response and early help does have a sort of an increase on the line there in the MTFP. But looking at development and commissioning, I was just wondering a bit of that looks really flat. Workforce development doesn't have an increase. Voluntary sector's gone down. I noticed also youth offending in ASB is flat as well. I was wondering what the implications of that. Obviously, inflation eats away at our spending power. What implications would those zero increases be, do you think, to the service?
Thank you, Councillor Sedker. If I could bring Christine Shield in to reply to this as commissioning officer.
Morning, everybody. Happy New Year. Yeah, in response to that, Councillor Snedker, we're working within the commissioning unit very strongly with the region and the sub-region to look at how we can bring costs of actual placements down and how we can work in a sort of model aligned with the LGA report that you refer to. We're really looking at what models of practice are working elsewhere and how we can implement them locally. It does come with a spend, and Elizabeth and I are working closely along those lines, but we are aware that it's a very provider-driven market at the minute, and that's what we are struggling with to try and turn the curve on that. And there are some plans that we are looking at currently to address that.
Thank you. Anybody else have anything they'd like to say? Elizabeth, I'll give you the opportunity to comment on that if you'd like to say something. Just one thing, Councillor Cruddas, I'll bring him in before I ask you to do that. Councillor Cruddas.
Yeah, I think with the commissioning costs, I think we've already made some investments in two schools where we put in extra facilities in that hopefully allow us to bring some of our children back into the borough to be looked after, to provide education, which hopefully will have a cost impact as well. So I don't know whether Tony wants to mention how we're getting on with those developments.
Tony, are you there? Would you like to say something?
Thank you, Chair. I think Councillor Cruddas is referring to the two units we're commissioning at Red Hall Primary School and Rice Car College to provide additional places for children with special educational needs. We've had some construction delays on those, unfortunately, due to COVID, but both projects are on track to be admitting pupils in the next academic year. So some opportunities there to provide more places for children with special educational needs in Darlington, to avoid the need for children to travel to settings outside of Darlington, which was a key tenet of the special educational needs strategy. It's one of the key tenets that we outlined there.
Thank you. I'm wondering if Councillor Clark is here. Is Councillor Clark in our meeting?
No, he isn't, Chair. No.
All right. He was invited though.
Yes, he always gets invited.
Yeah.
Yes.
Okay. Right, because one of the issues, of course, I think Councillor Renton makes a very valid point, that if we invest to save, that's the way that we can actually move forward. But unfortunately, it seems that Elizabeth has said in her briefings that basically we've got all the money that's down the sofa, and that, you know, we've taken things back just about as far as we can, but we recognize that investments need to be made so that we can save, and not just financially save, but also save on the heartache and the pain and the issues that affect families whose children go into care. So we're fighting against an economic downturn and COVID and 10 years of austerity that mean that many families are struggling. So if anybody can say, I know Christine mentioned the partnership work that's going on, because a lot of the things that we're asking for to support families are not just things that the council can deliver. They're things that the community needs to deliver together. And Christine, can you talk about some of the community issues? I know you said sub-regional and regional, but some of the things that are going on in Darlington, please.
Yeah, I was going to cover that off Councillor Hughes in the CYPP update, because a lot of the work that we're doing in that arena is really around preventing these children getting, and the families of these children getting to the stage. So I think Chris's comments around the cultural change and the work that they're doing in family group conferencing arenas and early help team, that has an impact, and also the work that communities are doing together on the grassroots level, that really has an impact. And I know that we're working strongly with our voluntary sector, and we have had pilot projects working around families with children who are vulnerable and experiencing real stress and challenge. And those pilot projects are coming to an end, and we've had some real positive outputs from that, which we're going to be reporting on in the next month or two once we've gathered those case studies together, and a report will be coming out from that element of work as well. I think the regional and sub-regional work is more around once children are placed and they are in expensive placements, how do we know that they are impactful and that they're having the right effect, which means that the needs of the child are reducing, and then how are we moving that child from that intensive support down into a more sort of sustainable level of support as appropriate.
Okay, thank you, Christine. We'll look for that in your report coming up.
Okay.
Any other questions for Elizabeth? No? Then Elizabeth, can I bring you back in if you have anything else you'd like to add?
Thank you, Chair. No, I'm just going to concur with what people have been saying. I mean, starting with Councillor Enton's question, yes, it can't continue on because we can't keep affording it. But obviously, we do understand that children's services is probably one of the most important services. So we continue to invest, and that's why we need to put money into the budget for it, and extra money. With regard to the work that Chris mentioned that we're doing with the DFE in Leeds, we did get some money from the DFE for that, which is really helpful. So a lot of these initiatives where we can pull money in actually helps to I suppose pre-fund, and it is spend to save. And I suppose I will always say spend to save, absolutely. If we can save money in the future, I will find the money to spend up front to save for the future, as long as it's not 20 years time. Being realistic, but yes, absolutely, that's what we need to do. Yeah, and that's all I had to say, really. I think just from a committee point of view, it's whether you are happy with the recommendations in the MTFP to report back to the Economy and Resources Committee. Thank you, Chair.
Thank you, Elizabeth. I think that the comments that have been made in relation to the flat line with the things that Councillor Snedker raised, I think that, you know, they need to be included in any response. And I'm wondering how we can do that. Should we, Alison, will you pull those comments together and then they can be sent along with the decision of this committee, which we'll now take?
Yes, certainly. I can make a note of that and then forward that on to Elizabeth with those comments. Yes, absolutely.
Thank you. Then committee, are we willing to accept the recommendations as they appear in the MTFP that we've been presented with? Yep, if you could indicate with your little hand thing. Right, Alison?
Yep, that's fine. I've noted I've got all hands. Yeah, it's definitely carried. Yes, all hands raised. Yeah.
Right, thank you. And thank you, Elizabeth, for attending our meeting.
More than welcome. Thank you, Chair. Bye.
Next, if I could turn to item 5, which is the Darlington Parent Care Reform Report, and it gives me great pleasure to welcome Cara Garraway to our meeting. And Cara, I'm sure you'll have something to say with one of the things that was mentioned on the last item, and that was including families in discussions about what happens to them and what happens in relation to their children. So if I can hand over to you to perhaps speak to the Parent Care Reform Report and to just tell us a little bit about that forum.
Yeah, absolutely. So good morning, everybody, and Happy New Year. Some of you will know me and many others not. So my name's actually Carla Scaife now, sorry. and I am the coordinator for Darlington Parent Carer Forum. And so a Parent Carer Forum, I don't know if you know anything about them, but basically the code of practice says that every local authority, education, health and social care services should work with their Parent Carer Forum in their area in participating and co-production with families. So we are a group of parent carers of children with additional needs living in Darlington, and with the Department for Education recognised forum. I will start by saying thank you for having me. I have been in role for 5 and a bit years now, and I will say that participation and engagement in Darlington is far more effective and happening than it has ever been. So, you know, we are there and people are listening. However, sometimes it is just engagement and not getting it right. But I will say that the will is there, so to speak. The pandemic obviously took everybody by surprise, and we're not here to say that there was a right or wrong way of doing it. It was unprecedented times, and you know, you're probably sick of hearing that phrase, but we do have to recognise that actually during that some of our families really slipped through the net, unfortunately. And back to what you're saying about involving families, it is absolutely key. And I think that the message, we tried really early on to host meetings with families, find out what the issues were, and local authority were absolutely fabulous in terms of, I was going to Tony and saying these are what parents are raising, and Tony was going to heads and saying this is what's happening, you need to tell your schools and whatever, but it wasn't happening on the ground. And in terms of risk assessments, obviously I've included that in the report and in the data. I will mention that I've been rereading this morning, and I apologise because I have made an error in the report where I say that only 4 families were involved. And it was actually 5, because 4 families were aware and 1 family had been involved in a risk assessment. But these risk assessments were developed to be co-produced with families and be done in partnership with them. And I just think that that's really, really sad. And yes, we've only surveyed 51. We've only got 51 responses to this, but I do think that in terms of SEND community, that's probably quite a high percentage. Well, enough to be representative. So with 51 families, only 5 knew that a risk assessment had been done about them, and only 1 family had been involved in that. And that was an assessment that was designed to be done with them and not to them. And what we heard was that if you were at home with your children and you got a phone call from the school, that was your risk assessment. But nobody ever told you that was your risk assessment, and nobody mentioned that it was going to be used to decide whether you needed services during the pandemic. It was just, you know, something, and it just comes back to happening to and not with. And I think that in terms of resource, that is massively where we're getting it wrong, because those families might have needed something just really, really small in the beginning and have now hit crisis because there was nothing offered at the start. And we did also have some really fabulous responses in Darlington in the very early days. Like I say, Tony was fabulous. He was meeting with heads and saying, look, the forum are telling us this isn't happening. We set up weekly Zoom sessions with Helen Daly from our Send IAS service to help to answer questions, which went down really, really well. And we also worked with our CAMS service as parents were telling us what the issues were, we were trying to set up online sessions. So we did some sleep workshops, and we did sensory strategies in the home, behaviours, positive behaviour support strategies and things like that. So there was some really, really good practice in response to issues, but also a lot of families not getting the support that they needed. And actually as well, really concerning for me is that the message from local authority was always very clear that if a child had an EHCP, then they should have a school place, should they wish to have it. And that wasn't the message that we were getting. The message that we received more than once was that children were being told that they weren't to be in school. And we know that the advice from the Department for Education was that it was only if the risk was to the child about not going to school that they shouldn't be given a place. However, we were hearing horror stories of they can't come in because there isn't the staff in, and we're having to use our staff to spread about bubbles. And that's obviously included in the report and in the data that we covered as well.
Thank you very much for that hard-hitting report and for your just being candid with us. Thank you for that. I spoke to you early on in the pandemic, and I was concerned then, and I'm more concerned now, to be honest. Can you give us just a little bit of information about what's happening now? I know it's not in the report, but from your conversations with families.
Yeah, so as you can imagine, it's been a very busy weekend and my phone has not stopped. And I'm like, come on, it's the weekend. But even more confusion now, I would say. Obviously, schools are all over the media at the moment about whether they should be open, whether they shouldn't. But not just this weekend. I think that the inconsistency of information generally from central government and in the media and everywhere has really impacted upon families knowing what's happening. And I had a request last night from a parent who was really, really in distress, and her child's attending the home to hospital school at the moment, has a home to hospital placement, and she didn't know whether they're going to be in today. And actually, for a child with significant additional needs or who is in a service like that or a special school or anything, not having that clarity of information is a really big deal. My own has gone to Nana's this morning because she's also not in school, and I couldn't function with her here, bless her. But it is really just the not knowing, and I know that is coming from a lack of clarity of information across the board. But I also think that we need to have some sort of strategy around that as well, because all we're able to say at the moment is if you haven't heard otherwise, then I assume that you're in. But yeah.
Thank you so much for that, Carla. I'm going to open up questions to the committee, and Councillor Renton, and I noticed that you're indicating.
Yes, I had a question on page 76, but you partly answered it. But I think as this is a huge failure in the earliest part of the COVID process, probably the risk assessment is the most important part. We need to know why this mistake was made. So who could we get to answer this question as to why we failed to engage with parents? Obviously, it's not your fault, but we need to know whose fault it was and why that happened. We need to learn from that. So I think really it's a statement than a question.
I think it is important to note that we did raise this at the time, and I know that action was taken and individual schools were called, but the assessments had already been done at that point.
Right, thank you for that. I know that committee, Carla, early on when we had statistics on the number of children with education healthcare plans that were not attending school, we did ask questions then, and there was a sort of an answer that said that just because they weren't attending school didn't mean that they weren't being educated in some way and being assisted in some way. I wonder if you could comment on that aspect, because that's what we were told.
Okay, so I can't speak. Obviously, this isn't a question that I've been asked for before. So to answer it fully and confidently, I'd like to go back to our parents and say, was this the case? However, based upon feedback and conversations that I've had, I don't believe that it is the case. It was everybody was home learning. It was all online. And it wasn't always accessible to our children with additional needs. And I can say that as a parent of a child with an EHCP, that actually Teams learning is not for her. So she didn't do anything other than things that I did with her. So that's the answer that I can give you confidently about my own child. I would like to answer it definitely, but I would like to ask parents so that I could be confident in my response.
Carla, before I bring Councillor Snedker in, I think that that's an important question that committee needs answering. We have an evidence gathering event planned for the 21st of January, and it would be great if you and some of the young people and some of the families involved might be able to give us some evidence and not, information just from their own lives and their own experience. Obviously, what happened then is important, but equally what's happening now is probably more important, because if there are gaps in what's being offered to families now, we need to give some, challenges, not only to Tony, who, from what you're saying, did everything he could do, but we need to do more to encourage schools to do more if that's necessary. So I'm going to bring Councillor Snedker in. And Councillor Snedker?
Yes, thank you, Chair. When I read this report, I was quite stirred by this report. It rang alarm bells loud and long with me. Sort of the idea of no conversation about me without me sort of springs to mind. Not only because of disrespect, that is disrespectful to do that. So the idea that risk assessments were carried out when people didn't even know this was happening and had no input into it. But it also raised alarm bells for me about decision making, because once you lose the person about whom you're making decisions from the process, then even with the best in the world and the best practitioners, mistakes will be made, people will be lost and left behind. And this seems pretty broad across the board spectrum, that people were being left out of the conversation. And that feeding back to what we've said in the previous agenda item about early intervention being effective, using our pounds wisely, the very few pounds that we have, using them wisely to the best effect. And these are people who need our support and help. This does cause me great concern that if this is what we're doing here with these people, it's been highlighted because of the pandemic. Is this happening elsewhere? Is this more systemic throughout the service? I hope it isn't. I hope this is a result of reacting to a pandemic and a national emergency, that these people fell through the cracks. But it's a question I have to ask: is this highlighting a systemic problem where we're making decisions about people but without them being involved, and people just not being aware that decisions were being made, or places just weren't being offered, or were being offered in a way that couldn't be taken up? How do we, can we get those answers today, or is this something that we need to come back to as a committee?
Tony, can I bring you in relation to this, and then we'll come back to Carla, but I'm sure you'll have something to say about that.
Thank you, Chair, and just echo committee's thanks to Carla really for coming this morning and presenting the report. As Carla says, she's been in Darlington in this role for over 5 years now, and brings a vast amount of experience and commitment to supporting parents in Darlington. So we are very lucky to have such an active and engaged parent carer forum in Darlington. That's not always the case elsewhere. So just like to committee to be aware of that level of engagement that the forum does take in this work. In terms of the points that the report makes, it is clearly very, very disappointing, and that has been the experience of families throughout the pandemic in Darlington. Carla is quite right, and she points out that the guidance was very clear around risk assessments, and when schools were undertaking risk assessments, that children and families should have been an integral part of that. Of that work, and there's certainly lessons we can learn as a system from this report. And obviously, as Carla's already alluded to, we're moving into unclear times again in terms of attendance at school. So even incredibly timely to hear the details in the report there. Certainly, it's something that I will be taking to the Education Strategy Group and the the Special Educational Needs Coordinators Network around understanding of why this has been the lived experience of parents through the pandemic, and how that can be addressed, because these risk assessments, as Carla would say, they are living documents. They shouldn't be something that was done in March and then not returned to. You know, they are living documents, and they should be live documents right now for children with education, health and care plans in our schools and settings. Chair, we touched on attendance, and it might be helpful for the committee to have a bit of detail around what the latest picture is nationally and in Darlington, to give you some context around that. So the last set of data that the Department for Education issued was in relation to attendance in the week of the 10th of December. And the Department for Education has been issuing weekly attendance records through the pandemic, but I haven't been releasing records around the individual local authorities. And the 10th of the centre data set was the first time that was done. So we can speak with a little bit more authority around this data set than previous ones. And at that time, nationally, 80% of pupils with education, health and care plans were attending school nationally. And in special schools nationally, 77% of children were attending special schools in that period. When we look at the data that DfE has published in Darlington, attendance for pupils of education, health and care plans in that period was at 89% compared to 80% nationally, and attendance in our special schools in Darlington was at 92% as opposed to 77% nationally. When we look at the breakdown of those figures, there is quite a gap between primary and secondary attendance when we look at the Darlington picture. So 92% of pupils of education, health and care plans were in attendance in schools in primary schools in Darlington in that period, and 75% in secondary schools. So that is not at all to dismiss the concern, clearly, but I think it's just contextual in terms of actually children attending their settings in the latest data period that we have. But clearly, I very much want to work with Carla and colleagues on the forum to work with schools as we move into another uncertain period. And if I may, Chair, Carla just mentioned around the situation for the weekend, so it might be helpful just to give some information and regarding the picture right now. So although Darlington is a tier 4 area, what that means practically is that there should be no barrier to any child attending a primary setting this week and next week, but there has been a staggered return for secondary pupils over this period, and the Secretary of State extended that staggered return, so we wouldn't expect the full complement of secondary school pupils to return until the 18th of January. But it's a really important point Carla made earlier, and that still stands. Pupils with education, health and care plans are still entitled to a school place and to attend their setting, even in this staggered return period. So, it's certainly what I am very keen to address, is some of those individual cases that Carla is hearing where there's been any sort of doubt or implication that would be an issue, because that is absolutely clear in all guidance that children with education, health and care plans can attend their settings if they wish, if families wish them to do so, regardless of the staggered return to education.
Right. Okay. Thank you very much for that clarity. Carla, before I bring you in again, I'm going to ask Councillor Cully to come in. Okay, Councillor Cully.
Thank you, Chair. My question is more, yes, Carla, thank you, great report. You say that Tony was brilliant, did all that they needed to do, and from the council then, from our point of view, it sounds as though the council are doing what they need to do. Is the problem then with other agencies, with the schools or with other people? What else can the council actually do to improve this situation? So is there something in our gift, something that we are not doing that we should be doing in the actual councils, from the council side? Thank you.
Thanks. Carla, before I bring you in, Tony, what is the statutory responsibility of the council in relation to children with special educational needs and how that relates to education? I mean, is it just to have a word with schools? Is that the best that we can do?
Thank you, Chair. No, our responsibilities are clear to ensure that the needs that have been identified in the Education, Health and Care Plan are met. So I don't want to speak and take away Carla's opportunity to speak, but on a practical basis, to answer Councillor Cully's point, one of the things that we can do practically as officers is to follow up Carla's report with our own audit around those risk assessments, and to re-emphasise the messages that have been given out before around the absolute centrality of those risk assessments for children and young people and families to be involved with them. As I said a few moments ago, Chair, these risk assessments will change over time as details of the pandemic changes, but also as children's experience change through the pandemic. So my view is they are living documents and they need to be constantly returned to. And as such, there is a lot that the local authority officers can do to re-emphasise the importance of involving families in those assessments as this school year progresses.
Thank you, Tony. Before I bring Carla in, do we have anyone from the education community at committee today? Because I know we've had apologies from Nick, John, and Tim Fisher, but is there anybody else?
No, I don't think so, Chair. As I say, you've had the apologies from the our education co-optees.
Okay, because it would have been very good to have the opportunity to hear it from the school side as well. But Carla, can I bring you in?
Yeah, absolutely. Sorry, and I think in response to Councillor Cully, that my honest answer would be I don't know what else could be done, but Tony's been clear that the responsibility is with local authority for children with education, health and care plans. But I would also say that it's with any service that's working with a family, in my opinion, which needs to be clear that it's my opinion at this point. I don't know ultimately what more could have been done, but I think that the really, really clear answer is to have just spoken to families at the time, any service that was working with the family at the time. I'm not looking to blame or to say this should have been done or that should have been done, but families weren't spoken to. And that's the bottom line of it. And I think that falls with any service who was working with a family at that time that made a decision to withdraw services, or that withdraw support, or that a school place shouldn't be allowed, or any of that. It was the responsibility of every service.
Councillor Cruddas?
Thanks, Chair. It seems that we've only talked about education in this particular debate, and the educational health and care plan spreads rather further than that. Mm-hmm. And in fact, the statistics that Tony read out about the attendance at schools shows that whilst the schools may not have engaged properly with the parents, and I go right along with that one, they did in fact provide the school places in line. In fact, we looked as though we might have done a bit better than the rest of the country in providing those school places. So my question to Carla really is the are there other services other than education that that this, from the health and care point of view rather than the education point of view, is anything there that we need to listen to?
Carla.
Yeah, sorry, I was just scrolling through the data to make sure I had the correct response. Obviously the emphasis has been on school placement then. And Tony, can I just check that the data that you gave, was that current data or during the pandemic?
That was a snapshot, Carla, from the week of the 10th of December, and the reason I referred to that was the first period that the Department for Education published local authority level data. So it's really the benchmark that we could refer to in terms of national trends. So that's why I picked that one period.
Wonderful, thank you. I just wanted to clarify that, and I think that that's important to note that by the 10th of December, you would expect that most children were back in schools because the schools were open, and that would include those with VHCPs. So I don't think that it takes away from, and I know that it's in the past now, but we still have to acknowledge that it happened, and that during lockdown, when children with VHCPs were allowed a school place, they weren't actually able to attend, because actually none of us know what's happening, and the way things are at the moment, we need to avoid that situation happening again. So I will move away from education now, though, because I know that it's had a little bit of maybe too much attention for this morning. We have had a lot of feedback. Obviously, a lot of the guidance was specifically coming from the DFE, was specifically around school placements and risk assessments and things. So that's what we can measure against. However, we do know of therapies stopping. A lot of the NHS staff were seconded to different areas. So, for example, speech and language therapy, occupational therapy, things like that did stop during the pandemic. So essentially you might have a child who had an education, health and care plan, was attending school, was getting regular therapies, suddenly had nothing. And that happened. More than happy to go away and get data from families to clarify that, but we know it was the case. I've spoken about the CAM service. The CAM service actually did respond really, really well in Darlington, and I did send a little report to the CCG to clarify that with some comments from parents about how fabulous they'd found it, because it's not common. It's not. It wouldn't be a shock to say. However, they did respond really, really well with offering online appointments, and they were still seeing in-person appointments. Offering in-person appointments too. But yes, quite a lot, and in terms of social care, quite a lot of the children and young people who receive direct payments, their support has stopped, and short breaks as well, as far as I'm aware. Cut back or didn't happen.
Right. Thank you for that, Carla. It would be great if you wouldn't mind, and if it doesn't, if it's not confidential, if you could send a copy of that report that you sent to to the CCG to us as well. That would be really useful, and it would be useful in relation to our evidence gathering, because the more we can find out about the experiences of young people and families, the better, because we'll be making some recommendations following our review. So that would be great. Do we have any other questions for Carla, or are we happy to release her? Because really, I mean, I am just in complete awe of what you're able to do and that you've done over the past 5+ years. And really, as Tony said, you're invaluable to us, but also as a carer, to be able to speak authoritatively and from the heart to other families. So thank you for that. And I also really appreciate the fact that when we ask you questions, you say, well, this is from my perspective, but really I need to reference it back to my group. And that tells us so much about how you as a person operate, but also about the group itself. And, really, I think we all applaud what you've been doing with the group, and those families that have had to, struggle and do the best they can during the pandemic, and it's not over yet.
No.
So if we as a committee can assist by shining a light and raising issues along with Tony and with others, I'm sure we'd all be happy to do that. So thank you very much for coming.
Thank you.
And thank you for all of your responses, and all the best.
Thank you very much.
Thank you, Carla. Thanks. Right, so if we turn next to our next item, one thing though, I wanted to say to all of you, I think it's time you stood up. So as I move on to the next item, Matthew's already standing up, great. But if you're not standing up, please do, and try to do that periodically. Even if you want to turn your video off, do that, but please stand up, because this sitting is not good for any of us. It's the new smoking, they say. So if we could move to item 6, which is the childcare sufficiency assessment. And Tony, I understand you're going to be speaking to that. And we have Helen Ellison and Nicola Davies also here, I'm told. And we have a guest, that's Marjorie Knowles, who's coming to ask a question in relation to that report. So Tony, if I could hand over to you, please.
Thank you, Chair. So as you say, my colleague Helen Ellison, who is Head of Education Partnerships, who committee will soon find is far more knowledgeable on this area than myself, is joining us. Thank you for Helen for joining us, and also Nicola Davis, who's a childcare sufficiency officer in my services. So committee, the report we've outlined is a report for childcare sufficiency assessment for 2020-21, and the report outlines broadly our statutory responsibilities in terms of childcare sufficiency as a local authority to secure sufficient childcare. So FANA is reasonably practical for working parents and or parents who are studying or training for employment, for children aged 0 to 14 or up to 18 for disabled children. And as part of our work in that area, we should report annually to council members on how we're meeting that duty. So this has been a regular annual report that has come to committee. Obviously, as we've discussed this morning, it's no surprise that a focus of the report has been childcare sufficiency during the pandemic, and how that's impacted in our assessment on how the sector will continue to be impacted by the pandemic. So the report outlines for the first national lockdown, with providers only being able to care for children of key workers and vulnerable children, similar to the discussion we've had previously. And by the 24th of April 2020, 52% of the sector had closed. At that point, following the loosening of those restrictions, the number of open providers increased, and the numbers of children assessing a place rose. And committee will note that a higher proportion of early year providers remained open in Darlington than in nationally. And by the 11th of June, 93% of private and voluntary providers and 67% of childminders were open in Darlington. In total, 71% of settings were open in Darlington compared to 53% nationally. And when we moved into July, that compared to a 61% of national settings opened. So, you know, it's an opportunity, as I've taken before, to committee in terms of school colleagues to you know, give our thanks of officers to the huge commitment of providers. It's a when we talk about childcare and early year settings. That can be a huge variety of settings, from individual childminders in their homes to settings attached to school settings to private and voluntary organisations. So the work that they did through the pandemic period, I think is to be applauded. And when those figures in terms of comparisons to national figures show, I think Darlington early year providers can be hugely proud of the efforts they took during that early part of the pandemic. As we moved into September, all providers that had closed temporarily reopened at that point. And just over 1,000 children were accessing an early years entitlement place at that point. And that figure equates to 69% of the number of children accessing a funded place if we go back to autumn 2019. The report also outlines some of the work the local authority has done during the pandemic period, very similar to our approach with schools. So we offered a number of virtual briefings for colleagues in the early years sector, virtual network meetings, public health briefings to providers, and Ken Ross has been a regular attender at those meetings, as well as weekly Q&A sessions. And we've also developed, in response to the pandemic, an early year strategy group to look at how the local authority can work with the sector more closely and more effectively as we continue to face the challenges around the pandemic. We've also established a childcare sufficiency task group working with colleagues from economic growth, CENDIAS, who were referred to in the previous report, Darlington Association for Disabilities, Job Centre Plus, and children's settings to understand how businesses have been impacted in terms of childcare need during the pandemic. The report also gives details of a parental survey that we've undertook via the task group. 643 parents responded to that survey. Broadly, there's been general parental satisfaction with childcare in the borough, outlined it in that, but there were some specific concerns that parents raised during that survey. The cost and flexibility of childcare, access to childcare for school-aged children, and access to childcare for children with disabilities. We're still in uncertain times, and the uncertainties created by the pandemic have made childcare demand in the future more difficult to predict. Consequently, we've identified that more targeted research is needed to establish from this spring term onwards what requirements are not being met from the market for children with disabilities, but also for parents requiring flexibility, such as shift workers. And it's clear that the economic conditions nationally are highly fluid, and providers are continuing to face uncertainty with regard to demand and how changing work patterns will impact on that demand. But our indications show that there has been sufficient capacity in the system this year to meet demand throughout the period. But we are continuing to monitor unmet need to ensure that over the remainder of this year that there is sufficient access to childcare, so parents are able to access training and work in the coming months. The report goes into far more detail. I'm sure, Chair, that members may have questions regarding that, but that's a summary of the report that's outlined this morning.
Thank you very much, Tony, for that gallop through the report. Just one question before I open it up to committee, and that relates to the insufficiency of places for those young people with disabilities, so respite care and just care itself. And the Joseph Rowntree Foundation in 1819 said that 25% of carers are living in poverty. And part of that is because of the lack of places of childcare for children with disabilities and young people with disabilities, which mean that carers can't work. So we've actually known, I mean, this is at least the 10th year that we have identified the fact that there are not enough respite and care places available for children and young people with disabilities. And yet what you've just said is that we're going to commission more research on this. So the role of the local authority, is it more than just identifying the need? I mean, do we have a responsibility to actually work with providers to be able to get them to step up to provide these places, or indeed even commission them? And I open this to Christine Shield. Maybe she'll mention this later. But do you have any reply in relation to that, Tony, just to set the tone for the questions?
Thank you very much, Chair. I think the reference to assessment and research is specifically in this report around some of the uncertainty we've touched on in terms of work patterns, work shifting patterns, training, etc., and how that will impact the whole sector, but obviously that part of the sector in particular as time goes on, and certainly the work that Darlington Association for Disabilities have done this summer in terms of the sessions they've been able to offer for holiday play schemes. That was impacted, so they were only able to offer a reduced number of sessions in that period, and we need to work with those organisations and others to ensure that there is sufficiency in the market, that families with children with disabilities are able to access training and employment opportunities, even through these incredibly difficult times.
Thank you, Tony. I think Councillor Renton indicated first, and then Councillor Snedker. Councillor Renton.
Oh, I actually think it was Councillor Snedker.
All right, well then, Councillor Snedker.
Thank you, Chair. Yes, Tony, thanks for the report. Looking at it, obviously it's written in, like all reports we're receiving at Scrutiny, in unusual times. But what's in my mind is obviously sufficiency of childcare as we come out of the pandemic. And while you're saying there's sufficiency right now, that's because demand is suppressed. And you also mentioned that all settings were open now, despite one's closing. They're not, because some have actually gone out of business, and so we have lost capacity from the childcare market, and that's clear to anyone who's seen the nurseries with the for sale signs up, or who've seen the change of use notices come through planning. So we've already lost capacity. The fact that we have sufficiency right now is because demand is massively suppressed, and so the questions that this report sort of really says to me is what is the clarity for parents and other carers going forward. The private sector, as I'm sure we all know, is not a massively profitable business, and they were operating very much hand to mouth. Premises and staff are expensive, and my concern is that coming out of this, how many are actually going to be viable coming forward? I've seen losses already. My concern is that they were hanging on, hoping that they were going to be, everything was going to be fine after Christmas. We were told everything was going to be fine by Easter last year. We were told everything would be fine by the end of summer last year. We were told everything would be fine before Christmas. We're now being told things should be okay by the spring. How many of these private businesses are just hanging on in there, maybe using private debt to keep them running? And my fear is that the lag in the industry will be that they will close just as parents and carers need the care provided for them to go back to work. And echoing what the chair said about special educational needs, you're right. I remember 10 years ago as a parent going into a nursery setting, becoming a governor, and hearing then firsthand from the forums I went to about how hard it was for parents of children with special educational needs to find a nursery setting, and they'd almost given up on getting them, and they'd written off going back to work while their children were at nursery ages. And that was a real concern and a real shame to hear it's still going on now. So I'm aware that this report is written in a pandemic, but that's not a reason for us not to look to the future. And echoing what the chair said again about our obligation to provide sufficiency. At the moment, we're speaking to providers. We need to hear back as a committee what the results of those conversations are and how we can guarantee that sufficiency of supply. Because at the moment, this report is talking about doing the right things, but I can't see it actually doing the right things as yet. Thank you, Chair.
Thank you, Councillor Snedker. Tony, would you like to come in at this point, or would you like to hear Councillor Renton and respond to both?
Yes, please, Chair. Thank you.
Okay, Councillor Renton, please. You're on.
Thank you, Chair. Thank you, Chair. I think I may have asked this question last year. I can't remember, so I'm going to ask it again. But it's not to do with COVID. It's actually to do with the take-up of early years funding in 2019, which I assume would have been a normal year. It says 2,337 funded children, and so that would say 2% of the population, which I think the national average is that 6% of the population is actually within the funded bracket. So 4% of children aren't taking up the early years funding. So is that because they're paying it for themselves, or they're just not taking it up? Or could you explain that shortfall to me, please? I have another question if you want to take it now, or just
yeah, if you just throw that in the mix as well, that would be great.
Yeah, and the other question was on the population data, the number of births dropping considerably, even though we have been told that our population is growing considerably. So could you put that into perspective for us? Is that because people are moving out of the borough, or I don't know, people aren't having as much fun? What's the reason for that reduction in births? They're my questions.
Right.
Thank you.
I hope you brought your crystal ball with you, Tony, but go ahead.
I'll take the last one first, and then probably ask colleagues to come in on a bit more of the detail in terms of the question around take up, Councillor Renton. But I mean, you're right to pick up on that. So with certainly when we're looking at projections, the last birth figures we've seen has been there's a 20-year low in birth rate in Darlington, and that will inevitably impact this market as time goes on, and will therefore that will then run through the system in terms of schools and colleges as well. Well, of course, we can't predict is what the impact of economic movement and economic growth, and whether that will impact in terms of those raw figures. But we are looking at a 20-year low birth rate, and it's inevitable that will impact in terms of this market. And if I may, Chair, I'll bring Helen in just on the specific point around the take-up percentages, if I may.
Sorry, could I just jump in? Is that in line with a reduction in the population already? Are people moving out of Darlington, or is it because people are having less children? The same amount of people having less children.
I don't have that level of detail, Councillor Renton, but so apologies. But I'm happy to ask the question and report back.
That would be good. Thank you.
That's great. Tony, can you also address some of Councillor Snedker's remarks before we move on to Helen, please? Thank you,
Chair. Yes, and thank you, Councillor Snedker. You know, for those points, and clearly, as I said at the start, the report is pandemic focused. But you're quite right that we need to look at the longer term impact and a sufficient market, as we all hope. But soon we'll be looking at a world beyond the pandemic, and is there sufficiency, and will there be sufficiency in the market at that point? I think it's fair to say from the sector's perspective that it's been a very difficult funding system to navigate through the last year. Some of that is the nature of how early years is funded, which is different from how schools and colleges are funded. You don't get that certainty around funding per number in terms of planning going forward. So for a provider that is heavily reliant on private fee-paying parent income, they will have been affected clearly over the last 6 months. Central government have put steps in place to try and address that. But I think it's fair to say that it is an uncertain market at the moment, both nationally and locally. One of the reasons we've set up the groups I referred to is we can have that direct discussion with providers and a range of providers across all types of settings to understand better how that can be that the local authority can support settings through that, and the reference to reopening, those were only the providers that temporarily closed. So forgive me, Councillor, I didn't mean to imply there had been no impact around permanent closure, but those settings that were temporarily closed during that early part of the pandemic or reopened in September.
Thank you, Tony.
Sorry, Chair, if I could just come back. One thing I noticed that was missing from this report was last year there was a set of statistics where you'd gone to providers and asked them about their confidence over the next 12 months. And you'd asked them, did you think that your position would be more secure, about the same, or less secure? And there was quite a large section of the market that was already feeling insecure a year ago. And that analysis isn't in this report. I presume that's something that will be coming to us fairly soon, will it?
Thank you, Councillor. If I may, Councillor Hughes, I'll bring my colleagues in on that.
Tony,
some of the others.
If we can hold off on your colleagues,
yeah,
we actually have a guest here today who has come from one of the nurseries. It's Marjorie Knowles. She's a trustee, and I think that Marjorie might have something to add to the discussion so far, but also Marjorie's come with a couple of questions that she'd like to pose too. And then I'll bring in Helen and also Nicola to help answer those. So I noticed that Marjorie Knowles' little circle is kind of flashing on and off.
Oh, I don't know why that is.
All right. So you're here, Marjorie. Wonderful.
I am, yes.
If I can hand over to you, please.
Thanks, Cindy. Some of you may know me from my former life as a councillor, but for many, many years, in fact, 20 years, I've been involved with Skene Park Community Enterprise Association, and we set up Parkside Childcare, initially as an after-school club, but then when the Neighbourhood Nursery Initiative came along, we came in on that, and we delivered our service initially from some porta cabins, and then we went into the Coleridge Centre, which was a fully integrated childcare facility. Within there was a school, adult learning, social services, really top of the notch. However, that, as you know, as time has gone on through austerity and whatnot else, that no longer exists. But we are still there, providing childcare, and nursery childcare and after school. During the pandemic, we remained open, except for 2 weeks when the school closed down and locked us out and didn't let us know that that had happened. Our intake, we do the 2-year-old funding and also the flexible 3- and 4-year-old funding. Our intake is, we have a lot of children with special needs, additional needs, I should say. In fact, the vast majority there have some additional need of some form. We are a community organisation. We've got a board of 5 people looking after that nursery, and we're volunteers. It is hard for the childcare sector, and particularly for the voluntary sector. We're not there to make a profit as such. Anything that we do make is ploughed straight back in again. But this year, yes, the pandemic has had a big effect, not just on us, but on other childcare facilities. So therefore, and we did reflect that. Councillor Snedker had raised about the confidence that the owners had in to carry on the business. We did answer that very fully, and we were a bit surprised that that bit wasn't in the report. However, that's given kind of a background to what we were. And the 2 questions that we would like to be responded to relate to paragraphs 22 in the report, about the group that's been set up, which relating back to what I've been listening in on the different thing about not involving people. That's the question we'd like to ask. What provider representation, if any, do you have on the groups? That's the Early Years Strategy Group and the Childcare Sufficiency Task Group. Surely these are tasked with delivering the early years offer across all sectors, have a vital part to play in this process. If there are representatives, and we don't know, how are those people chosen, and what systems are in place for providers to communicate with them to ensure they play an informed and representative role? Because if you don't have those representatives, how do you know what's going on? And the second question is to do with paragraph 38 about the further monitoring and evaluation of the market position. How does Darlington Borough Council intend to use the cumulative early years underspend reported as £314,663 to support those settings that face the biggest financial challenges? Will Darlington consider specific support packages for settings in areas of deprivation who will have low levels of private income and little capacity to bridge the ever-increasing funding gap with private fees? I think that's my question, Cindy. Thank you.
You're on mute, Chair.
I am. There's a car alarm going off in the street. I was trying to keep it quiet for you. Thank you so much for coming, Marjorie. And those of you that don't know about this particular setting, the Parkside Childcare, they set up this cooperative in a place where private nurseries wouldn't touch with a barge pole because of the type of needs that some of these young people have, and also the transport area there. So it's not as if the nursery is in competition with, you know, any private nursery that might want to set up there. So I just thought I would point that out. But Tony, if I can hand over to you, and then clearly if Helen or Nicola want to come in to address all of the issues that have been raised, I'm happy to have that happen. But if I can ask you to address some of that first, Tony.
Thank you very much, Chair, and thank you, Marjorie, for those 2 points. And I think the earlier strategy group, it's a developing body, and when we did set it up early in the pandemic, because as I referred to earlier, we felt it was incredibly important at that time. There was a mechanism between the local authority and providers for two-way dialogue, really. So the sort of thing we've been using it for, as I say, we've had Ken Ross from Public Health Perspective in, just giving views around that, and then that's guided the open forums that all providers have been invited to around risk assessments, around opening, etc. But I think we always want to try and ensure there is a sufficient provider voice on that group, but also the provider voice on that group is then seeking views of the wider provider market. So when we set up the group, we wrote to every provider to invite interest, to be willing to participate in the group, and that group was essentially set up to understand the local picture, facilitate communication and activity to support sufficiency, and particularly around the COVID-19 outbreak, and also to support colleagues around some of the issues around our most vulnerable pupils who attend those settings. So Marjorie, it was an open invite for providers who'd be interested in working with us on that group to come forward. As the group develops, then I certainly, I'm sure I'm speaking for Helen, we'd be more than happy to look at that membership again, and any providers that didn't express an interest at that time who'd like to work with us on that, then more than happy to have discussions around the membership of that group. The second group Marjorie's referred to, the sufficiency task group, I think she raises a good point. I covered some of the membership earlier, but that is a lot more focused on officers and other agencies. So I think that's something that we need to reflect on, Marjorie, in terms of that group. Is provide a voice on that group as well, and the extent of that, how we can include providers in that group as well. And as well as those two groups, as I said earlier, we have been holding regular Q&As and regular virtual meetings for all providers. Those are just small bodies for us to work through some of the strategic issues that have come to light through the pandemic. And if I may turn to Marjorie's second question, in terms of specific, if I'd understood it correctly, Marjorie's around the funding gap for those providers serving our most vulnerable in the community, and specifically around reserves in funding. So the reserve that is held on the early years block of the dedicated schools grant, I think the first thing to say is that's ring fence, so that can only be used for early years providers and support to those providers. It can't be used to support other parts of the dedicated school block, such as the high need block. So it is ring fenced. Early years funding is provided by the DfE based on the January census. So it can be the case that fluctuates over years. It can be the case that sometimes we don't receive enough funding in a year to cover the spend that the local authority has made, but it also can mean that some years there's a surplus, and that reserve amount can fluctuate. The reserve is generally used to balance early year spend between years, as we can overspend in some years due to the variety of numbers. And certainly this year, in terms of our support for inclusion funding for those vulnerable pupils with special educational needs, we've had to use reserve to support that funding this year. In terms of the wider point, I think, Marjorie, around mechanisms for funding, there is in the DSG formula setting a universal base rate for funding, and then there's the ability to use supplements on top of that, and there's a mandatory deprivation supplement which is used to target funding at children from postcodes with high levels of deprivation. But that, I think, one of the points you're probably making, Marjorie, is because that's a postcode mechanism that doesn't always translate straight to a provider serving those needs, or it doesn't necessarily translate to a provider with serving those needs. So the schools forum does have the opportunity to look at using supplements, a flexibility supplement, a rural sparsity supplement, to look at the formula and on how individual settings are funded. The mandatory deprivation supplement, it's a generally accepted method of allocating deprivation funding and education funding, but I appreciate, because it's based on postcode, that there can be individual anomalies there. When we've consulted, when the local authority has consulted in the past through Schools Forum around increasing the amounts funded through the deprivation supplement, providers, when consulted previously, have indicated they would prefer a higher hourly rate to be implemented rather than to implement changes to supplements. That's not to say that Forum shouldn't, that shouldn't be able to look at that again, and for providers to be surveyed again on their wishes on that going forward. But when we've surveyed in the past, when providers have been given that option, they've tended to support an increase in hourly rates per pupil there. But on the broader point around supporting settings, certainly we're looking at all ways we can at the moment, Marjorie, to provide additional support, and to ensure that we're putting in, we're letting provide.
Tony, I think we've lost Tony, haven't we?
Of any external support that they can be offered through.
Hi, Tony. Tony, if you can hear us, you're fading in and out. So probably the last minute or so, we didn't really get what you said.
Can you hear me? Sorry.
It's okay.
No, we still can't hear him, can we?
Nope. Helen, if you're there.
Sorry, Chair, am I back on the call?
You are, yes.
Okay, sorry, did I cut off?
Yep, just the last minute or so.
Thank you, Chair. Chair, just my final response in terms of Marjorie's question was about the broader point, really, in terms of wider support that we want to ensure providers are able to access. And I was just referring to a ministerial letter that the appropriate minister, Vicky Ford, sent out over the Christmas break, indicating that the spring term funding allocation, which will be notified of this month, the central government are looking at some potential changes to allocation there. So we will be in contact with providers when we've assessed that once we have had our final entitlement funding from central government for the spring term.
Great, thank you. Marjorie, are you satisfied with the information you've received? I mean, do you feel that that's been answered, or would you like to have Helen or Nicola come in to augment some of what Tony's told us?
Marjorie, you're on mute.
You're on mute.
What Tony has said suffices, but I'd be really grateful if I could have it in writing, Tony, with that. So is that possible for your responses to have them in writing? Oh, that would be really great.
Absolutely, Marjorie.
Yeah.
And yeah, absolutely no problem at all. I'm very grateful for the questions.
Thank you.
Thank you, Tony. If I can bring Councillor Ali in. Noticed your hand's been up for a while.
Sorry, I've got a bit of a sore throat. Happy New Year, everyone. I just want to, as much as we're here to, as a scrutiny committee, I'd like to share a positive story in the new year with everybody, regards to the adult and children's social working team and early help team.
Councillor Ali, does it relate to the childcare sufficiency report?
It kind of does, because when we were discussing about the disability association and things like that, so I'll be quick.
No, not to be quick, just as long as it's relevant to what we're doing at the moment, but that's fine. Sorry.
So where we work with these services for families that have children with disabilities and special needs, Darlington Association on Disabilities with the direct payments team have done some outstanding work, and I'd really like to bring that to everyone's attention. It was a particular family with several health issues with the parents and the child, with all sorts of language barriers and so many issues, but through this pandemic, through setting up Teams meetings and calls and interpreters, we got a successful story, and we have a carer in place with this family now, and mum's able to access things online for learning. It's a real positive story for all the services in Darlington working together through this COVID to really make a difference for this particular family. And there's a lot of things, and they've actually have faith now to approach social services and taking out that taboo and stigma that the children may get taken away. We actually offer services to support and help the service provider with service user, and it's been all positive. So just to thank all the teams involved, and direct payments and Darlington Disability Association did real outstanding job, and it's about raising across vulnerable families that these services do exist to support them. So we need to raise more awareness around the direct payments schemes that are available to support a family that have children with special care needs. So I just wanted to highlight that, and it touches on many of the subjects that we've discussed today, to be honest. So thank you very much.
Thank you, Councillor Ali. It's always good to hear some good practice and to celebrate that. Councillor Renton, can I bring you in, please?
Thank you, Chair. I'm not sure my question on early years funding take-up has been answered yet, but I had an additional to add to that from something you just said, Tony. Maybe a bit of an understanding question, but did you say that there's often a reserve in terms of the government having given us too much funding to cover that early years funding? And if so, is that figure based on how many children should be taking it up, or how many children are taking it up? Because there's obviously a huge discrepancy. So how is that calculated?
So with permission, I'm going to hand over to Helen, because I know that she can answer that question too, and I'm sure she'd like to have the opportunity to add a bit to what's already been said, and to go back to your first question about take up. So Helen, if I can hand over to you, please.
Okay, good morning, everybody, and Happy New Year. Yeah, quite a number of issues raised there, and Tony's obviously answered several of the questions. If I may, Councillor Renton, I'm going to defer to Nicola on some of your more detailed questions about take up, because she's the expert there. But something again that as a positive really that I did want to mention was that there will be an increase to the hourly funding rates for 21-22 that was announced by the DFE recently. So there will be an increase in the hourly rate for 2-year-old entitlement funding and for 3- and 4-year-old entitlements as well. Again, it would be our intention to passport that to providers, and that will go to schools for them in the usual manner. I appreciate that it's been an incredibly difficult time for providers, and it's a small thing, but it is a small positive. I would also like to say thank you myself to all of the providers who've done an absolutely amazing job through the pandemic. Our early years providers have worked tirelessly to include children, to encourage children to attend, to support families, and to reassure families, and they've done a fantastic job. The providers who have volunteered to give us their time and work with us on the strategy group, again, I'd like to thank them, because they gave up time when they had no time to give, really. They were incredibly busy. And one of the huge benefits of their input has been that we've been able to run some of those online virtual network sessions with other providers for providers to share their experience, and the providers who had remained open and been able to remain open to share their experience of how they were handling things with providers who were getting ready to reopen again, and that's been invaluable. So I'd like to say thank you to them too. Just on the sufficiency, and I think it comes back to Councillor Snedker, you raised the issue about the future and the uncertainty of the marketplace in the future. The figures in the report that you've seen there talk about a September figure, excuse me, and talk about the occupancy being roughly about 69% of the occupancy in the same term of the previous year. Our provisional figures show that the attendance increased steadily through the autumn term. So we know that attendance towards the end of the autumn term was significantly higher than it was at that point when the report was written. Now that seems to mirror what's happening nationally. So the ministerial letter that Tony referred to also points to that happening across the country, and I think it seems to us as though our picture in Darlington is very similar to the national picture. So we have been able to cope with sufficiency through the autumn term and to occupancy levels that are significantly higher than that 69% that's quoted in the report there. But again, I appreciate that there is uncertainty and increasing uncertainty at the moment about occupancy going forward. The ministerial letter also refers to potential changes in patterns of childcare demand. And again, this is a question that's being raised nationally, is, you know, will patterns for childcare demand change? And it is something that we need to be abreast of in Darlington. Our officers do work individually with providers on a day-to-day basis to talk about sufficiency, to broker places for parents if parents are unable to find a place. Our officers do step in and support with that. And again, just in terms of context, our our inclusion service are working to support settings both through our inclusion funding, but also with guidance, advice and guidance for over 90 children currently in Darlington, to support settings to ensure that those children's needs can be met. With regard to the questions on take-up, I'm going to defer to Nicola, if I may.
I think Councillor Renton, my understanding was Councillor Renton had a question about normal sort of take-up in 2019 during average times. Basically, for funded 2-year-olds, Darlington has around 85% of the eligible funded 2-year-olds in a place, and the national average last year was 72%. For 3 and 4-year-olds who are accessing 15 hours, the universal entitlement, normally we hover around 95%, and the national average is between 94 and 96%. 30 hours, it depends upon the term. Occupancy builds throughout the term, but we're between 600 and 880 children in a place throughout the year. I don't know whether that's helpful.
No, that is actually. Yeah. Thank you. It's a better picture than I read it.
Great, thank you. I've just been looking online for the Vicky Ford letter. Many of her letters are on the internet. They're open letters. I don't see this latest one. And I'm wondering if you could possibly send that to Alison so that committee members can have a look to just see what the minister's actually been saying and what you've been referring to. I think that would be helpful.
Yes, of course, Chair. More than happy to.
Thank you. Before we move away from this particular report, is there anything that anybody would like to have clarified, or are you content at this point, committee? No? Then with that, I'd like to thank Tony and Helen and Nicola for coming to the meeting, for the work that you're doing, for your pardon me, invitation to providers to join that early years strategy group, and also to provide information as to how providers can become part of the school's forum, because clearly a lot of decisions are being taken there, and there may be settings that don't actually know how that procedure works. So thank you for indicating that you'll be welcoming more providers to become active, and also to ask questions. I know one of the questions Marjorie asked was in relation to how settings, what the reporting back procedure is, because clearly if there are representatives on the school forum and settings aren't aware that they're speaking on their behalf, then it's probably no wonder that, you know, higher hourly rates are prioritized as opposed to supplements for rurality or for deprivation. So as long as it's a fair process, then that's great. So thank you again for attending, and Happy New Year to all of you. So if we could quickly then move on to our next item, which is number 7, Children and Young People's Plan. And we've got Christine Shields here. Christine, if I could hand over to you, and I'm sure you'll be taking questions in relation to that. And Marjorie, thank you for coming. Would you like to say something before you depart? I see your hands up. No. Okay, Marjorie's gone. Thanks for coming. Christine?
Thanks, Chair. So the Children and Young People's Plan was adopted by Council in September 2017, and it runs to 2022. At the time of writing, we identified 7 priority areas that were aligned with not only presenting needs, but also the aims of the Sustainable Community Strategy for Darlington. Now, this plan is for all children who live in Darlington, and as a consequence of that, it's the responsibility of all provider agencies to help drive and deliver the outcomes from the actions that we take to deliver on the plan. As such, we've got a multi-agency steering group that's very vibrant and well attended, and we had a look at this and refreshed a little bit of a minor refresh during the summer, because we were mindful that the COVID pandemic had a substantial, I'll put my teeth back in, substantial impact on a number of local residents, and notably on families and children who are vulnerable. So when we looked at the report that officers had done around the impact of the pandemic on the local residents, it became apparent that we really needed to focus on what we thought were 3 key priorities over the next year or two. That was to continue looking at mental health and wellbeing for children and young people, which has been adversely impacted by the pandemic. To continue to look at child poverty, which again will no doubt have been impacted by the pandemic and the impact on the local economy, but also to bring on board another priority, which is youth unemployment. Now, we had thought of adding youth unemployment into our key priorities for action from the beginning of the plan, but we decided at that point that wasn't coming across as a key area for concern at that time. Looking at the impact, it now becomes apparent that that will potentially have a negative impact on future employability for young people. So as a result, over the last year, we've been working in terms of mental health and wellbeing, and the local transformation plan core group lead on this work. And again, it's a multi-agency group covering both local authority officers, health officers, education officers, voluntary sector and others. And they've been working, looking at the data and looking at the Health Watch report that was published just before Christmas, focusing on children's mental health and well-being. So there's been an awful lot of work being undertaken around this, and just notably in the paper you'll see that I've outlined Couth Online offer for counselling services is being progressed and built upon. We've been doing a lot of work, which is trailblazer work, and that's joint commissioning around local authority, health and school partners. And it's based on the Anna Freud School Link programme. And as a result of that, we're offering and increasing the offer to schools locally around telephone support for staff, and also a psychological wellbeing practitioner to be put and linked into school environments to provide additional support for education partners. That work will progress through the next year, and we will be looking at further work coming on stream built upon what the data is starting to show us. In terms of poverty, there's been an awful lot of work done with Citizens Advice Bureau, both in terms of the Darlow Millions programme, and that's around increasing benefit uptake and maximising those people who are eligible for benefits but who haven't been uptaking them. And that's successfully brought into local residents an additional 1.5 million. And we are maximising the community care grants that CAB have on offer to people through the financial crisis that families have faced as a result of the pandemic. We continue to work on the local wealth procurement framework, and that's really focusing on better paid employment, not just employment, but better paid employment for people working with local businesses and partners. The bread and butter thing, which people will no doubt be aware of, continues to be well utilised and mobilised. And we've also managed to run out the Into programme, which is focused on years 6 to 8 and encourages them to undertake cultural and sports activities that they wouldn't have been able to access or hadn't accessed previously. In addition to this, we set up the Uniform Exchange programme, and since August last year, there's more than 800 families that have benefited from that Uniform Exchange programme. So there's been a lot of work undertaken. So underneath each of these groups, there are key programmes and projects that have been operating. More recently, we've had the winter grant rollout, which government allocated about 364,000 to Darlington at the beginning of December. And we have agreed a policy for how we will allocate this funding. And that's basically focusing on those families who are eligible for free school meals and care leavers, and we were basically operating a voucher scheme which has been through our legal and procurement processes to ensure that that's administered effectively. And in addition to that, we're going to be supporting further the bread and butter thing in this new year period. We have been discussing the fact that there is now going to be a staggered approach to pupils going back into school following the Christmas period, and we will increase the amount that we were originally going to allocate. We had a contingency pot that we kept back for this sort of scenario, and we'll be looking at extending that free school meal programme over the coming weeks. We're going to wait for the guidance to come out around the holiday activities and food programme, and that will run from the Easter, so the winter grant led up to Easter into the end of March. This new programme will run through the Easter and summer and into the winter period of this year. We're waiting for guidance on that, but it looks like we've been allocated around 450,000 for that particular programme. And underneath all of this is the development and commissioned bit of work that Council had asked for around child poverty needs assessment. So we've undertaken a large piece of work to have a local needs assessment of child poverty across the borough, and that's hopefully going into Council in February, March time this year. In terms of youth unemployment, we set up a task group very recently just to scope out what the current offer looks like, because we have got programmes that are running currently to support youth unemployment, notably the YEI programmes, Youth Employment Initiative programmes locally, Routes to Work programmes locally, and others. And we're wanting to maximise all available funding that's available through the TBCA and the Job Centre Plus. So we're going to make sure that Darlington maximises the funding that's made available for this issue. And with that in mind, we're going to hold a symposium, rather posh word, symposium in early this year, just to agree the model of how everybody's going to work in partnership to improve employment opportunities and link to local businesses and the need that they will have for certain skill sets moving forward, and to make sure that we've got the involvement of all relevant partners. So that's where we're at currently in terms of the CYPP and our plans moving into the next year or two. Obviously, we'll be using this to refresh the plan, which comes to an end next year, as part of the work of the steering group. And I'm happy to answer any questions. And I'm aware it does link very closely, Chair, to the vulnerability of families and what brings children into the care system in the first place, and how we can prevent that as much as possible.
Thanks very much, Christine. You said at the outset that this is a plan for all children in Darlington. So very often we focus only on the most vulnerable and those that we have statutory responsibility for. So this report, I welcome it, because we're taking in all of the children and young people within the borough. So I'm going to open it up for questions. Any questions in relation to the update? Councillor Renton.
It's not a question, more of a comment, and I'll probably be quite unpopular for saying this, but I think this report, and in fact the whole agenda, really shines a spotlight on how damaging COVID has been to this borough. And I'm not necessarily talking about the virus, but I'm talking more about shutdown policy and the uncertainty that's putting parents and people and families in, creating often unnecessary and very difficult situations. And we saw it in this report in terms of youth unemployment. Unfortunately, employers often focus on experience, and young people, this year, a lot of them have lost a whole year's worth of experience, and then will find it difficult to find another job because of that. In terms of kids missing important time in their education, this is time that they will never make up again. They'll never have that year back, or the in and out of school, and no amount of online learning can cover for the actual support a teacher can give in the classroom. And in the last report, the damage this is doing to young children in a vital time for their socialisation. I've got a 1.5-year-old daughter, and she would have been doing baby groups 5 days a week in normal times, but she's hardly seen another child this year other than her 2 brothers. beginning to question, well, if the long-term effects these lockdowns are having on children, young people and families already struggling, and our council's finances, whether they're actually worth the short-term fixes that they might or may not be having. I don't know. I'll get off my soapbox, as Councillor McEwen would say.
Right. Thank you for that. I mean, I think you've said what many of us have been thinking for a while, but I think that what we need to do is focus on what actually can be done. And it's a very depressing situation that you've described and that, you know, we're living through, but we need to optimize the opportunities that come our way by working with others. Otherwise, we may as well just all pack up and, you know, go home. Oh yeah, we are home. Councillor Snedker, I'm looking to you for some optimism, please.
Thank you, Chair. Yeah, it is what it is, I believe, Councillor Renton. We could wish we were in New Zealand, but that's not going to help us now. What is interesting about this is you're looking for how we come out of this and how we get ready and prepared, given all the, you know, what has happened to the very young children, the older children, and those young people in our town who've borne the brunt of this, really, as far as economic crises for them. I thought it was interesting. A written answer to a question to council talked about the opportunities for employment in the future without migration depressing wages, which I thought was an interesting answer to a question. And it is very much the young people who start off at insecure, low-paid work in Darlington, and these insecure and unpaid, low-paid work is seen as a way into something else. And those have largely gone, or they've disappeared totally during lockdown, and their availability after lockdown again drawn into question. And it just, again, looking sort of over the horizon, having read greatly about the real living wage and how that has worked in parts of the town, particularly Brighton and Hove, an area of the country I'm particularly interested for no great secret, and also hearing from employers about the benefits to their economy of having staff who have a higher retention, higher productivity from that. Is this the time where we actually stick our neck out and go, let's stop talking about how awful it is and how terrible it is. Let's look for maybe a policy that we can't bring in ourselves as an authority, but something we can support, nurture and incubate, and maybe look at a better future. And that idea of a real living wage economy, universal basic income, something else I'm looking at, but that's beyond my pay grade. So, you know, that's just maybe thinking out loud, maybe, and I'll stop, and that soapbox I can hand on to someone else now.
Right, thank you. Councillor Cruddas, I'd be disappointed if you didn't have something to say.
Yeah, absolutely. I just think that, you know, I've taken a lot of good things from this meeting. You know, I think our officers have performed fantastically during this pandemic, and we can always pick holes in what's happened. But I just, the most significant thing to me is that whatever we're doing to spend our way out of this at the moment is a debt for our children. They're the ones that's going to have to pay for it. We aren't paying for it. So we need to be careful that we don't overspend the money, because it'll just be a burden on our children. And from a children's point of view, you know, it's a very difficult way that we have to navigate through this thing, and throwing more money at it is just creating more debt for them. So I think forums like this, where we think about all the things that we can do and the best way of doing them and the most economical way of doing them, is something we just have to keep our chins to the grindstone and keep doing it. I think people are doing that, and unfortunately, being a retired gentleman with a garden and lots of lovely countryside around me, the whole year's not been a great trial to me, but I do have great sympathy for the people who it's not been like that. But I think we should all be optimistic and try and get on and find ways through it. Like Matthew says, there's better ways in the future, I think. Nothing more.
Thank you for that, Councillor Cruddas. Just some of the points. I mean, in relation to the plan itself, interestingly, and I don't think it's by accident, those areas for priority are the areas that we will actually be focusing on at our event on the 21st of January. And part of that is to talk to partners, to talk to families, and to hear the voices of young people themselves so that they can tell us their experience. And we need to focus on some of the things that can be done and are within our grasp, and that may not necessarily cost a lot of money to implement. One of the things that you mentioned in the report, Christine, is in relation to Trailblazer funding. My understanding is that that won't actually begin until September, and that the groundwork is being laid, which is important. You highlight the use of COOTH, which hasn't even been evaluated yet. So, I mean, we're putting a lot of hope in things that haven't been evaluated and actually haven't begun yet. But I think recognizing that there's a genuine need, a growing need for that area of mental health support is a step in the right direction, but we need to keep maximizing the opportunities. You also mentioned the Darlow Millions, which is a great initiative. I thought the focus was on older people and getting older people to apply for the benefits that maybe they hadn't applied for in the past. And I haven't seen any statistics in relation to the money that's come in and the percentage that actually were in relation to families with children. So I'd be very interested in getting that data from CAB, if you have it, if you could share that with us. I think that would be really useful.
Yeah, I'll grab hold of that data for you, Chair.
Thank you. And my final question is in relation to who's actually holding this multi-agency group to account and working with them, because the Children's Trust has been disbanded. I know for a time it was the Darlington Partnership that was the holding body, and then I believe it moved to the Health and Wellbeing Board. So really, after some clarity in relation to the role that this committee plays, and also how as ordinary members, we can be sure that this plan that's actually working to give children a better start in life and to help them through, and also to monitor, what we're doing in relation to youth unemployment. Whose responsibility is that now?
Do you want me to have an answer for now? Because my understanding is that the CYPP not only reports up into this group, but also the reporting through their own individual organisations routes as well. And ultimately, yes, it goes into Health and Wellbeing Board when they meet with a focus on children and young people. So we try to cover off as many groups as we can so that we've got involvement from SEND steering group, from the voluntary sector groups, etc. But it is an innovative group of people, and I think that's what's the positive of the steering group, is that you get innovative, very cost-effective ideas for projects and how we work together and how certain projects link with others, and that's the beauty of the group at the moment.
That's really useful, but I think that part of my reason for asking is that it seems that multi-agency group is sending information to others. And we're hopeful that our evidence gathering on the 21st of January and beyond, we'd actually like to have an input into this plan and into the multi-agency group, because we believe that what children and young people have to say is important to how this plan's developed.
Yes,
so absolutely. if you could help us to understand the scaffolding mechanism and how we can actually influence it, because we'll be sending our recommendations to Cabinet, but clearly this plan is held by many more bodies than just our Cabinet.
Yeah, I will do. Yeah, I'll get that on. I mean, just for reassurance, we do have 2 officers who do the link work directly with the children that they work with out there. So the Darlow Care Crew and the Youth Parliament, they are all linked into the group as well. So we definitely get the feedback from children on the ground and what they think. And when we do the refresh, they'll be a critical part of it, as they were last time when we did that work. So.
Which is fantastic. And it goes back to what Marjorie Knowles was saying, that as long as you're part of a group that can input, you're in. But it's the many, many others that don't have that connection. And we need to be sure that all the voices are heard. And I know officers are doing the very best they can, but if we can help, we'd be really happy to.
That would be great.
So
thank you very much.
Thank you so much for attending and for your comprehensive report.
No problem. Thanks all and take care. Bye.
Thank you. If we could move on then to item 8, which is probably one of our most important items on the agenda. If I can hand over to Sharon Rain to just give a brief intro, and then I'll open it to questions.
Thanks, Chair. Yeah, you've got the performance indicators summary report that went out with the papers. So I'll take you through sort of the highs and lows, if you like, where we're performing well and where we need to improve. Happy to take any questions, and I believe Chris is still with us if there's any operational issues that we need to pick up. So members will be aware that this is the performance report that takes us up until the end of September 2020. So I'm conscious that's quite a way away now. So if there is any more up-to-date data that I can provide during the meeting, I will do that if there's any particular requests for that. So, I mean, again, like every other report that we've seen today, this report is written with the backdrop of we were in a pandemic period when this report was written, and quite naturally, some of the performance indicators were affected by that, both in the positive and in the negative. So obviously one of the positive decreases is around our missing episodes. That shouldn't come as a surprise, being as we were supposed to be under restrictions. And we know that we've had some particular issues with young people who didn't comply with government restrictions, and that we worked with those children and young people intensively. But generally missing episodes were down during the period. Performance against initial child protection conferences being held in time is still really high, particularly with regards to our benchmarking groups. We know that all of our children are allocated to a social worker. That has been something that's been in place for quite some time. We know that we have good performance around children subject to child protection plans being managed timely. So we don't allow children to sit with a child protection plan for too long. The numbers of children who are on a plan for more than 2 years are very, very small. One of the big positives that I think has come from the situation that we've been working in, and it's something we need to look at as we move forward as to how we embed this in our normal working, is around statutory visits. Obviously, face-to-face visits have happened where they've needed to happen, but a lot of contact with children and families has been as our way of doing this meeting now electronically, and we've seen an increase in our timeliness of visits by using those different methods. As we move forward, we'll need to evaluate how effective they are, and social workers are already starting to do that. And I don't need to remind sort of members of the importance of having that actual contact with children and families and actually accessing homes where it's safe to do so. So be assured that that happens where it needs to. Our performance, I think members will remember from probably 18 months ago, we were underperforming in terms of our stability of children's placements, and there's been an awful lot of work carried out over the last 18 months on that, and our performance is now really, really good in terms of children who've had 3 or more placement moves and children who are placed outside of the borough, and that continues to be a key focus for the service moving forward. Similarly to the child protection visits, our children in care visits have been more timely for the reasons I've discussed earlier. And our care leavers who are not in employment, education or training has still performed well. Obviously, that's something we will be looking at really closely moving forward based on the conversations we've just had on the back of Christine's report. So, areas where we are focusing on improvement. The first one is around our timeliness of referrals. And we have seen a drop in the timeliness of referrals. And I'm sure Chris would welcome the opportunity to talk about that if needs be. But that has really been to focus on increasing the quality of the inquiries that we do when a referral comes into children's social care. And I'm sure a lot of members will be aware of the work that has been taken forward through the Strengthening Families programme on that, and how we're looking to deal with contacts into children's social care in a much more relational way, and improve the quality that we do upfront to make sure that children get the right access to the right services at the right time. So whilst it's a drop in timeliness, I'm very confident that the counterbalance to that is a real increase in the quality of those referrals. Something that we've started looking at over the last couple of weeks and will continue to do so is our referral rate. That's higher than it's been in quite a while and higher than our target. And again, this is one where this could be as a result of the situation that we've been in over the last 12 months, in that we see children being referred, we do some work, or we do some assessment work, we do some inquiries, we put in additional support, and then unfortunately those children come back in as a re-referral. So that's something we will be looking at in terms of any trends or any patterns that we need to be aware of. Timeliness of assessments, again, has dropped below our target of 90%. That target of 90% is a very stretching target, and members will remember that that target was put in after we were judged to be inadequate by Ofsted, to really set a bar of saying we want really good timely assessments. I think, again, with the backdrop of the work we're doing with Leeds around the quality of how we work with children and families in their assessment process, and this idea of assessing with the family and not doing it to the family, means that our assessments in sometimes are taking longer, but they are looked at every month by the head of service to just make sure there isn't any drift in delay, and that those assessments that took longer actually did need longer to take that assessment forward properly. Again, similar to the comment I've just made about the re-referrals, children becoming subject of a child protection plan for the second time has crept up a little bit. And again, we need to understand, has that been as a result of the pandemic? Are there any trends that we need to know about in terms of that? And then again, a hot topic that has been discussed numerous times this morning around our number of children in care. At the end of September, we were at 302. And I know Jane previously talked to a scrutiny committee about some of the reasons around that. If I just let you know that as of today, that number is now 287 children in care. And I think Chris mentioned earlier, the work of the Strengthening Families programme is all around making sure that we intervene as early as possible to prevent children coming into care where there could have been another outcome for that child and that family. So out with the performance report that we produce regularly, we are doing an awful lot of analysis around those numbers of children coming into care, and have looked at various sort of models of what that might look like when we roll out the work with Leeds. So happy to come back to a future meeting and talk about any of that with Jane and with Chris. And then, not surprisingly, we've had a dip in our review health assessments for children in care, although that is a much better picture than it has been over again the last 18 months.
Councillor Renton.
Thank you, Chair. I think I mentioned last year an interest in seeing figures on the amount of care workers we have, the amount of case loads they have, and also our turnaround in terms of employment turnaround. Are those figures available?
They are. I can certainly get hold of those.
I think they're really important, actually, because that's, you know, that comes right down to the crux of the problem, is that stability. It's been mentioned in this committee before, stability with care workers, with families, having the same person coming in and out and not having new people every few months, because it's quite a difficult, my wife works in care, it's quite a difficult industry to be in, and there is a big churn problem. So seeing those figures would be really helpful, I think, to this committee. Just one other thing on dentistry, and I was going to mention it, I don't know where I was going to mention it, but my kids haven't been able to have a dentist appointment for a whole year now. So, you know, we talk in this committee about tooth health, or whatever you call it, but that's a massive concern. If you consider all the children that have not had their teeth looked at for a whole year, we could be having a massive year of fillings in the next year. It's not good. So, yeah, thank you.
Thank you for that, Councillor Renton. Sharon, I wonder, when you supply those the data in relation to staff turnover and the numbers of social workers and that kind of thing, if you could put it into context of maybe a period of time, and also to give the department an opportunity to say some of the things that are being done to try to address those issues, because clearly we need to keep on top of, you know, our staff, agency workers, and also permanent staff and that kind of stuff. We've learned bitterly that that's an area that we really need to keep on top of. So if you could do that before our next meeting, that would be brilliant.
Absolutely, we monitor that every month, and that's reported into the management team, so it's not a problem.
Thank you. If you could send it to Alison Hill, and then it can be circulated not only to Councillor Renton, but to all of us, that would be great. Councillor Snedker.
Thank you, Chair, and thank you, Sharon, for going through the report and highlighting the pluses and the minuses. So thanks for that, and again appreciate the workload and the swiftness with which colleagues of yours changed working practices to protect vulnerable children. So appreciate that. And it was interesting to hear again this message is coming back that this alternative and flexible working where distance visits actually are having benefits as well. We've heard that from young people as well. It isn't just coming from practitioners. I think members of this committee have also heard that children and young people are finding that this can work well for them and provide a better contact. So it's important we don't lose that when we struggle, fight to get back to normal. And it's good to hear you repeating that. Again, it also interesting and good to hear you saying about early intervention and early help and preventing children coming into the care system where we can. It's best for them, as well as the financial implications for us and ability to use that money elsewhere. But it does make me sort of question this idea, but some targets here have slipped, some targets haven't been met, some figures have gone backwards. These targets were there for a reason. As you said, they were imposed on us when we were seen as inadequate. And I think it's my role within Scrutiny to ask the question is like, how far are we prepared to let these slip? If we're saying we're doing well in other areas with our early intervention and we're looking to make the contact richer, and that was great to hear. We're involving the parents. It's not being done to them. It's being done with them. That's great to hear. You talked about timeliness falling, but because we're trying to do more in the assessments. So what I would like to say is, how are we getting this balance right? If these targets were set to keep us good and to protect vulnerable children, how do I as a councillor know that we haven't gone too far? Does that make sense?
Sharon, please.
Yeah, it's an interesting one, and I think it's one we've battered around as a senior management team in children's for a little while. And I was around when we were inadequate and went through the pain of the recovery from that. And we did need to set some very stretching targets to say that this is our ambition as to where we want to get to. And a lot of those targets were really to sort of set a management direction that says these are our expectations. And that was very much when we didn't have processes in place within children's social care to ensure that we knew how effective our practice was. And I think if you sort of track the journey of any authority that's been inadequate and then's moved into the good and the outstanding areas, there's not always a direct correlation between their what I would call process indicators around timeliness. There's not always a direct correlation between them being the most high performing, but also delivering outstanding and good services. There's a balance between having those processes in place and allowing the flexibility for good quality social work practice, because we're not dealing with widgets. So it's something I did a lot of work with Suzanne before she departed around. Yes, some of these targets are very stretching, and no, we don't want to lose sight of some of the process type indicators, but we also need to shift our focus to understanding the real quality of social work practice with children and families, and are we really achieving the best outcomes? So we monitor this every week, and it goes into management team every month. So there's no sort of taking your eye off the ball. But I do think over the next 6 months, particularly with the work we're doing with Leeds, it is the right time to say, actually, are some of these targets right? Or are some of them a bit of a sort of a perverse incentive to get things done quickly rather than very high quality? And my team do all the benchmarking and do all the research around the outstanding and good authorities. And we have some outstanding authorities who are delivering fantastic outcomes for children and families who do 70% of their assessments in time, but they do them all to a really, really high standard. And I'm sure that's what Chris is going to come in and say as well, so I'm not going to steal his thunder. But it is about striking that balance between having a processed approach, and we absolutely needed that when we were inadequate, to really allowing good social work to flourish. But I'll stop and let Chris come in.
Thank you, Sharon. Before I bring Chris in, I was just going to refer to number 7, which is looking at the allocated social workers. And again, we have 100% of our young people having been allocated social workers. But what does that actually mean? In the sense that we're still hearing from young people issues about continuity and also about part-time social workers. So I think it's not only balancing, you know, the quality and the timekeeping, but I think we also need to look at the indicators themselves and the information that's coming across to us, because basically that 100% allocation doesn't really tell me very much. So Chris, can I bring you in, please?
Of course, thanks, Chair. I think firstly, in terms of just that last point on stability, we do focus quite a lot on the number of social workers that children and young people as they move through our systems have. One of the other elements of the Strengthening Families work with Leeds has been around how we could reduce those numbers of changes. So one of the things we did with change and how our social work teams operate was we at least created a structure whereby, appreciating that there will always be issues around sickness, around people naturally moving on to other roles, maternity leave, etc., which will create the need for a change of work, but actually creating a structure which allows a child or a family to have one consistent social worker with no inbuilt changes throughout the process as they move through. So that's seen some positive changes in terms of the numbers, but we can certainly include that within the stability report that was requested, just to give some more detail around that. And it was really just to come in and I suppose give members a little bit of reassurance, particularly in light of Councillor Snedker's point around kind of how far do we let this go. We've got a number of systems inbuilt underneath this. We knew that there was an acceptance that we wanted to allow those arbitrary figures some flexibility, but within that there's a need for a real scrutiny from ourselves to allow you to scrutinise effectively underneath that. So what we do is there's a weekly meeting that I chair, and Sharon's part of that from performance, and a number of our other children's services managers, and that looks at every single referral and contact that we've received in the previous week. But rather than have a focus particularly on the timeliness of that, it's really to look at the quality, the information that's recorded. Do we have a really clear rationale of why we've made a decision, why we've become involved with a child or a family, or why indeed we've made a decision not to become involved with a family? So that's given us some real rich qualitative data. It's really about how we can allow that to be captured in a format that would be helpful for members to blend in with the quantitative data that we provide. And I think the other element that's important to note, and we don't really capture it as well as we could, is we almost subcategorize referrals and contacts. So when we talk about contacts and referrals there within 24 hours, that will encompass, for example, situations where we're made aware of a child that is at immediate risk of significant harm that we need to intervene, just to give assurances. They do not proceed beyond the 24 hours. They do not proceed generally beyond a 4-hour period. We will respond immediately to those. But within those circumstances, there are also situations where we'll perhaps receive information from a member of the public or from another professional agency of a family where in all likelihood those children aren't at risk of significant harm, but the family have a number of complex, multifaceted issues going on within the family. It may be that an early health worker is better placed than a social worker. It may be that a health professional is better placed. And it does take time for us to really triangulate all of the information to get the best response. So I think in light of some of the anxieties around those timescales, what we are endeavouring to do is to kind of break down the contacts and referrals into those that are significant harm and give some reassurance that we're responding to those extremely timely, but to highlight for those where it is progressing beyond 24 hours, my clear position would be that it's right that that goes beyond 24 hours and perhaps having one target for all possible types of contact and referrals isn't the most helpful thing. And if we can find a way that we can actually break down the different types of contacts and referrals, because for some it does take 3 days when we've got a number of different people involved. And as we've talked a lot in this meeting, we want to involve families fully. That's extended families. We want to speak to grandparents and get their understanding of what's going on and what they think would help. And in a number of situations, it's much more important that we focus on what is the right service and the right outcome rather than what is the right timescale to achieve that.
Thank you, Chris. Just one question springs to mind in relation to what you've just said. It's that trust that you build up with people who actually take the step to report something, whether it's another agency or whether it's a member of the community. And when you don't act on things as quickly as some people might hope you do, is there a mechanism to feed back, and do we capture that feedback? Because in the past, that has been an issue, that information comes in and it seems that stuff isn't done with it. And I don't want to, let you think that I think that that's the case now, because I don't. But I think that it's about the evidence that it's not.
Of course. In line with all of the processes we've described, we have changed the front door to move away from email contacts, which was very much the methodology up until the start of this last financial year, really. So just around when lockdown was initiated in March, we just strived on our new methodology at the front door, which was encouraging telephone conversations to really have that transactional conversational analysis with members of the public and with partner agencies. So we have that conversation, but the social workers then at the front door will send an email to set out what has been discussed, what the issues are, and what the decision that's been made at the end of that process. So essentially the outcome of that call, we then have existing escalation policies where professional challenges can be made if the decision making is felt not to have been correct or appropriate for that family. So yes, in short, we have those mechanisms in place.
Thank you. Any other questions in relation to these performance indicators? No? Then thank you very much. Thanks, Sharon, and also Chris for speaking to those, because as I say, this is probably the most important element of our work here today, and we recognize that. And we're going to keep, snapping at your heels on these things because it's important. This is an important part of what we do. So thank you very much. Right, if we could then move quickly on to our next item, which is the work program. And really, it's you've had a chance to look at that. And Alison, could you just give a brief update in relation to the letters that have gone out in regard to the evidence gathering event?
Yep, certainly. In line with obviously members' discussions when we discussed it previously and the quad of aims that was pulled together, I have contacted, sent a note around to all of the primary and secondary schools, which I have had some response back that they're going to gather that sort of written evidence. A number of charities, Mind, Humankind Charity, Food Bank, Church, King's Church, I've sent invites out to those as well. Children's Services are working with me to gather names of children to attend. That could be from the parent carers team as well. Carla has volunteered to come along. Children in care, care leavers, youth MPs being mentioned as well. So those invites have gone out. And again, various organisations and businesses have extended the invite out, waiting on some feedback again from those. Public health, health representatives, Health Watch have all given me names to come along as well. So yes, so it's progressing well at the moment. Thank you.
Fantastic. Thank you. And obviously in relation to that, I think our priority is to hear the voices of young people, children and young people, because we can take written evidence. And in fact, what we'll be doing is putting together a little pack of information that we'll need to read, for instance, like the Health Watch report on mental health and young people. I think that's going to be a vital report. Alison did send it out already to everybody. And I also would welcome the opportunity to have maybe another just closed meeting amongst ourselves to talk about those topic areas that maybe we could focus one or two members on asking the questions, so it's not as intimidating for the participants. And we could talk through maybe some of the questions we'd like to ask. Obviously, I don't want to control everything or muzzle people, and because it might be spontaneous. You hear something and you think, oh, I would like to ask that. And I also know that we'll all take special care, especially of the young people that are going to be coming to us to offer their evidence and their views. But I think we might need a meeting before that event just to talk through some of the ground rules. Okay.
That's certainly, yeah, can arrange that, not a problem at all. Yep, certainly.
Great. Anything else in relation to the work program that anybody would like to raise? No? Okay, then I think we'll set a date for our discussion about the evidence gathering. And I think if we wait maybe another week and a half to see the responses that have come in, and it may actually be, depending on schools and what happens next, we might have to look at that date if it's an issue. But I don't want to, I don't want to prejudge anything or preempt anything, but we really need to just be aware that we may not be their top priority in organizing young people coming forward. Right. So in relation to the next item, supplementary items, I actually did receive a response from the police. It was actually Adrian Green on behalf of the Chief Constable in relation to our questions regarding nitrous oxide. And I think rather than taking the time now to tell you about that, I'll just send you a copy of the response. And then if we need to raise it further, we can do that as a committee. Okay, so with that, and oh, sorry, any questions? No, I'd really like to thank everybody who's attended the meeting and participated today. I think that we've actually done our job, and I'm proud of the fact that we've asked the questions we have and that we have read our papers so carefully, because children and young people need to be the priority of everybody in Darlington and the borough of Darlington, and we need to be at the forefront of that, making sure that that happens. Okay, so thanks very much for attending, and we'll be in touch about our next get together. Thank you. And to members of the public attending, thank you.
Bye. Thank you, Chair. Bye.
Thank you, Chair.
Bye-bye.
Thanks, Chair.
Okay, bye-bye.